Good afternoon. Today we are lucky to have Jannat and Dhruv with us, and we are going to talk about their journey which has led them to have two beautiful babies. How old are they now?
They are driving us nuts. They started school. So.
Okay. So we will talk about Jannat and Dhruv's journey before you came to our center first.
Sure, I can give a lead, but perhaps you'll be the best to carry on from there. See, ever since we have been together since we were dating and early days in college, and since we got married, Jannat has had endometriosis. So we've always known that and a lot of doctors have told us that with endometriosis there are chances of having fertility problems, and there will be chances that it'll be harder for you to conceive. So we knew very early on that we should go ahead and get an expert opinion before we even start the process of planning for a child. And that's when I think Jannat, I don't remember how you got the reference for Dr. Banerjee, but somebody gave us a reference and we came here.
Yeah, I think I did like a lot of research at the time. So because I'm not from Delhi and I was living in Delhi and not having a permanent doctor here, so I was also looking for someone who would know a lot more about endometriosis. So for me, I feel like I had a lot of negative experience also with doctors, because given the condition, everybody tends to scare you. So whenever I would leave a doctor, I would walk out with a lot of fear and anxiety and you're young, so at that time nobody's really talking about fertility issues. Like we got married fairly young as well, so I was very nervous about the whole thing. So in fact, I remember the very first time we came and saw you, you actually sent us back and you said, try naturally. So I think for me that was a big sigh of relief, because I also knew that you are not someone who was pushing me into this, you didn't want to, you wanted to follow the least invasive method possible, and in fact that is what brought me back, I would say, because that's where I knew that I'm in good hands.
And to that note, I think that's something that we both appreciated, is that you have a method of going as natural as possible, and then as being as least invasive as possible, following it really step by step, not going very aggressive from the very beginning, and I think that gives a lot of faith and comfort to you. And you did tell us to try and conceive naturally, and we did try, and we went back, but it wasn't successful, which is why we came back for the actual beginning of the treatment. And I remember we did.
So I think that year we had 2 failed cycles.
Yes.
I know it's a lot, but looking back now, I feel like it is not just IVF alone. There's a lot of external factors, a lot of internal factors, which is your own health, mental health. So I think everything sort of has to come together for a pregnancy to be successful. And when you are in that situation, then it all makes sense. So maybe it wasn't the right time. So I think when I look back, I actually feel good. Maybe I'm glad it didn't happen then and it happened later. I think we were a lot more ready for it. And the environment was a lot more conducive, to having babies. Both of us, I feel, were more settled in our lives, even in our careers.
And I also appreciate that that we then decided to step back, and even you even guided us that we did, I think, 1 or 2 cycles back to back, and then we, I think the 3 of us mutually decided, okay, let's take some time off, because doing cycles back to back can take a toll, physically, mentally, emotionally. And then we took a breather, enjoyed all the other things that life has to enjoy, then came back with a fresh, perspective, armed with more intelligence, more learnings, more experience. And then the third time was a charm. And true, I think I remember you had said that there's a very, very high chance of within 3 cycles of having a successful attempt.
And I like that you were positive. So you're like, if you're 1 down, that means the second one, the chances of the second one being successful are even more, and the third time even more. So I think it's how you look at it as well. For other couples, I feel like when a cycle fails, you go back feeling really depressed and you're upset because you've been waiting for that moment, and then you feel disappointed.
But,
obviously that's
but that being
bound to
said,
happen.
it does happen, right? No matter how much we prepare ourselves mentally, there is always this thought that what if it doesn't work out, and when it doesn't work out, there is this fear that will I ever be able to conceive, and would we ever be able to do this?
Correct.
But I think it's very important to just soldier on, and I think it's not a matter of like, it's just as long as one doesn't quit, I feel like there is light at the end of the tunnel. So
Correct. So, from the discussion, it's very interesting, though we are doing it on a daily basis, but the points of giving time,
Right.
going through it in a logical way,
Yeah.
and of course, hand holding through the period makes a lot of sense, because it's definitely not
Yeah.
easy to go through
Yeah.
the IVF cycle. So, thanks for recapping those stages that you went with us. So, anything else about our place, our center, and then finally a few words to the couples waiting out there who are apprehensive, tense, don't know what to do, don't know where to go. So
Yeah.
that would be appreciated.
I can start. I have some
Okay,
interesting
sure.
points. So one thing that I absolutely love about the AFGC Advanced Fertility and Gynecological Center and Dr. Kaveri and the team is that you have a lot of capabilities in-house, and we don't have to run, from pillar to post. We could do the semen analysis here, the blood collections here, all the ultrasound can be done here. You do the ultrasounds yourself. You are trained in surgery yourself. So it was almost like, as opposed to, I would imagine that, if you were to go to another, to a big hospital or to a doctor who's practicing independently, they may or may not have all these facilities and infrastructure in the entire ecosystem. So for us, we just have to come here, so we have very, very fond memories of just coming here, getting everything done here.
And it's became second home for a while,
and
where the receptionist to
And I-
the other doctors to the nurses, they all recognize you. So I
Yeah.
think that adds a lot of comfort, especially as a patient, because nobody's used to so many injections, hormones. It's a very different experience, and you're very emotional also, because it is you're coming in the hope of having a child or a few, right?
Yeah.
So I think just that comfort level that you brought us and your team did, I don't know if I would have that if, like you said, if there's multiple doctors, it's very difficult to have that understanding with so many people and for them to understand your case. It becomes very mechanical.
And we also have to compliment you and your team on your pleasant personalities and demeanor, and the fact that you give us the attention and the time to patiently explain things, because we've seen in the past that doctors are in a rush. They themselves are very stressed and anxious and nervous, for whatever reason, and that kind of transcends into the patient as well.
Correct.
But when we step into this office, and I think I must have told you this many times before, I feel like there's a full Zen state happening over here in this office. There's great natural light, there's greenery, there's statues of Buddha, and there's Dr. Banerjee with her amazing Zen calm attitude.
Thank
So
you so much.
it's very nice and reassuring.
Yeah, means a lot. I mean, that is what we try. That it should not be just a quick in, quick out. Once you understand what is going on, then it's easier to go through it,
Right.
rather than fumbling and you're not sure what's actually
Yeah.
happening with your
Yeah.
body. Yeah, that means a lot.
Yeah, thank you.
And the words of advice? would you say?
Yes, very important.
I think words of advice are one is to have patience, because I think anybody coming in for IVF obviously has some sort of issues that they're dealing with, and most of them are hormonal. So I think the mind plays a big role here, and at the end of the day, I feel a baby, an embryo, is a foreign body, right? So for you have to make your body conducive so that it doesn't expel it. So I think it's so you really have to be zen. You have to make your mind stronger. You have to make your body stronger. So if you focus on yourself,
It's holistic.
I think
Yeah.
you have to it's a lot more holistic for your success rate to be high. And having said that, I think the other part of it isn't too bad. Like it is a few injections here and there, but I think if your mind is strong, it can be a very comfortable experience, and you all will have everybody who comes here will have you, and you will guide them through the process. I don't think there should be any fear. We've had such a great experience, and I would, if anybody ever needs you, we're always there to give them feedback, personal feedback, or any kind of advice. But
That's really very important. That there's a lot written about IVF.
Yes.
that it is painful, you need to stop work,
Yeah.
it's so traumatic that there's the fear of the info in the net, in the web space,
Right.
sometimes stops people from seeking any kind of treatment,
Right.
whether it's medicines,
Yeah.
IVF, non-IVF.
Yeah.
So, but the fact that you feel that you can go through it, and you
Yeah.
need to prepare yourself
Right.
and be in that state to accept it.
Yes.
That gives it a pleasant journey,
Yeah.
and at the
Yeah.
end, we
Yeah.
have some beautiful
Yes, I
people
was sure. Yeah.
waiting
Yeah.
for us. So
Right.
I really appreciate your time that you
Thank you for
spent
having
with
us.
us today, and wish the babies, wish them all the happiness and good health and wishes from our end.
Thank you.
And once again, thank you for spending your valuable experience and time with us.
Thank you so much.
Thanks so
Thank
much.
you, doctor.
Thank you.